Good afternoon. Welcome to day 290 at the St. Clair County EMA office, where we bring you the latest in the numbers for the COVID. Joined here with Chairman Mark Kern and the Director of the St. Clair County Health Department, Barb Hope. Barb, and you have our numbers today.
We do. Good afternoon, everyone. So far in St. Clair County, we have tested 203,553. That is an increase from yesterday of 1,016 individuals tested. Of those, 146 were positive, including males and females under 1 year of age to 90 years of age. That makes our daily positivity rate for St. Clair County of 14.4%. So we have a total of 20,350 positive and 183,203 negative. Unfortunately, we have several deaths to report in St. Clair County today. We have 9 additional COVID-related deaths. A female in her 60s with underlying health conditions, 3 males in their 80s, 4 females in their 80s, and a female in her 90s, all with unknown health conditions. Makes our St. Clair County total deaths due to COVID-related illness to 321. Again, our sympathy goes out to all those families and their friends. We have 18,570 individuals that have completed the 10-day isolation period requirement as required by Department of Public Health. Statewide, we have tested over 13,336,658 individuals. That's an increase of 4,453 since yesterday, for a total of 942,362 positive cases. And also, we had a large number of deaths in the state of Illinois at 105, for a total of 16,074 deaths across the state. Hospitalization numbers, again, are very high today. St. Clair County hospitals, we have 118 patients in the hospital due to COVID, and 14 of those are on ventilators. Region-wise, again, very high numbers, 207 hospitalized in our region due to COVID-related illness, and 20 of those individuals are on ventilators. Updates from our congregate living centers. We have some updates. Yesterday, we reported that Garden Place had 4 cases. We are correcting that today. Garden Place, these reports are for those individuals that live within that facility. Garden Place had tested some individuals that were outside of that facility. So the 4 cases we reported yesterday are coming off their list. So they don't have any cases or any deaths at Garden Place. For Brea Belleville, we have 1 additional case, making it 81 cases and 8 deaths. Integrity Healthcare in Belleville, we have 1 additional case for a total of 80 cases and 2 deaths. For Cambridge House in Swansea, we have 4 additional cases for 13 cases and no deaths. At Caseyville Nursing and Rehab, we have, again, 1 adjustment on their numbers, 1 less case, but we have 1 additional death to report. So their totals are 160 cases and 9 deaths. And at Mercy Rehab in Swansea, we have 3 additional deaths, for a total of 116 cases and 8 deaths. And finally, at Freeburg Care Center, we have 2 additional cases and 1 death, for a total of 53 cases and 2 deaths for those congregate living centers. Again, testing is readily available throughout the county. We have our 330 West Main St. Clair County Public Services Facility that is opened Monday, Tuesday, and Wednesday this week from 8 to 4. Short lines, so you can get through there rather quickly. Again, just Monday, Tuesday, Wednesday this week from 8 to 4. Also, of course, at St. Clair County Mall, 8 to 4 Monday, 7 days a week, except New Year's Day, they will be closed. And also this week, we will be out at the fairgrounds on Thursday from 8 to 4 at the St. Clair County Fairgrounds. And also this Saturday, January 2nd, we will be at St. Clair County Fairgrounds from 8 to 4. So lots of testing available. Please, again, take advantage of that. And, of course, follow the 3 W's and doing your social distancing and washing your hands and wearing our mask. So with that, I'll turn it over to the chairman. How are you, sir?
I'm good, Barb. Thanks. And back to Garden Place. So those 4 cases, as long as those people lived in St. Clair County, those numbers are still going to show up or did show up in our zip code report. It's just that they weren't at Garden Place, and so the particular cases assigned to that particular facility, that isn't happening. But those numbers are being credited to.
Right, if they lived in St. Clair County, they would be reflected in our numbers that were reported positive cases, and as you said, in the zip codes as well.
Okay, great. So we'll move into the zip code report then. 62201 up 2 to 449. 62203 up 5 to 502. 62204 up 2 to 318. 62205 up 3 to 505. 62206 up 4 to 981. 62207 up 7 to 452. 62208 up 13 to 1163. 62220 up 4 to 1,393. 62221 up 14 to 1,954. 62223 up 8 to 1,223. 62226 up 8 to 2,208. 62232 up 11 to 664. 62239 up 5 to 314. 62243 up 1 to 480. 62254 up 2 to 601. 62258 up 2 to 735. 62260 down 1 to 506. 62264 up 4 to 239. 62269 up 30 to 2,199. 62285 up 1 to 404. And 62289 up 2 to 36. 146 new positives, 1,016 tested, brings our daily county positivity to 14.4%. We put that in the rolling average, and today we're up to 11.8%. Regional positivity, this is the state, how the state looks at us as a region, is down today to 11.7%. Remember, 6.5% is where we need to be to reopen, and we're a long way from that. Bond County came in at 9.3% today. Clinton County, 7.6%. Madison County, 12.4%. Monroe County, 26.3%. Randolph County, 22.5%. St. Clair at 15.2% today. And Washington County high at 36.7%. The numbers continue to go up, Herb, and the hospitalizations, they've continued to stay high. It's a disturbing number. And then, of course, adding 9 new deaths today. We're way above that national average of 1 in 1,000 people that have died in our county. We need to arrest that number. 9 deaths is just shockingly unacceptable.
Well, unfortunately, when we have some people out there that continue to make comments, and Barb, maybe you can explain this again. I know it's been explained time and time again, but this new lady on here says, stop testing the healthy people. Can you explain to them the purpose of why we need to be testing as many people as possible?
As many people as possible, and you may feel healthy, but people can be asymptomatic, and you have no idea you're sick, that you could be a carrier. So that's one of the main reasons, obviously, to get tested. Another reason to test is just to get an idea of how much COVID we have in the general community. That is why that is used as one of the standards for the mitigation orders, not only for the state of Illinois, but across the United States and for across the world, to see where are we at and what else do we need to do. We are at a high rate of positivity. We need to control that and make sure people are staying home and following the rules to make sure we try to control the disease. But especially if you may have been in contact, you don't feel sick. And you could be a carrier and you don't even know it. So we need everyone, encourage everyone to get tested regardless if you're having symptoms or not, because you could be a carrier and not even know it.
And there's general spread. I mean, so we just went through the zip code report. Virtually every zip code in St. Clair County has new COVID positives. And this virus isn't being spread by people who knowingly want to spread this. Much of the spread is by people who don't know they have it. They're giving it to people who they're around, many of whom are family members, loved ones, maybe at a holiday gathering or wherever, but it's occurring. And to say don't get tested because you're healthy, well, who knows they're healthy? Not, we all are doing our best. Team St. Clair is doing our best. They're washing their hands, watching the social distance, wearing masks. But you never know. You just, until we get a vaccination, which we're all looking forward to the day when everyone gets vaccinated. But until we get that vaccine, we cannot be assured that we're healthy. And the only way that we can combat this virus is to get tested, figure out if we have it or not, and if we do, isolate. Until that time, until the time the vaccine is out to the general population, this is where we are right now. This is the way that we can control the spread.
Well,
And along with that, if I may, a lot of folks, when we call them and say you have a positive test result, they're shocked. They had no idea that they were even remotely positive. They were just doing because my wife drugged me here, or my husband drugged me here, or my mom drugged me here, whatever, and they were shocked that they're positive because they had no symptoms whatsoever. The other thing with testing, that's the official way, if you're negative or if you're positive, to make sure that your employer knows that you're not going back to work, either being sick and spreading it. Routine testing, again, that test is only for that day and that point in time. And as Chairman said, it's everywhere in the community, so I may test negative today, but I go out in the next 2 or 3 days and somehow pick it up. Now I'm a carrier again. So again, that test, is only for that point in time.
well, and 9 new deaths, as you said, and frankly, I mean, that just pulls at your heart. And we 321 of our county residents, and then when you have people that don't understand after it's been explained time and time again. We just read an article today, Brian and I did a study that was done at Washington U in the VA Center. These people who say it's just the flu. Well, there's vaccines for the flu. There is none. Now there is, hopefully, that we can all get here soon for this COVID. So to compare that to the flu is apples and oranges as far as I'm concerned. Until everybody gets their sleeve rolled up and gets that injection, like you can with the flu, as we talked yesterday, you can still get your flu shots. Right now, we're just in the early process of getting the vaccine for the COVID. So please just stop and think before you make statements like that. People need to get tested so we can try to stop the spread of this. 9 new deaths in one day is terrible. 105 across the state of Illinois. Our daily county positivity rate at 14.4, which is better than yesterday. Again, today we're recording 65 people out of that 146 under the age of 40 years of age. That ought to send a message to all the younger one. I had the staff post up earlier today. We had quite a few calls last week about grants, loans from the government, what they call the business interruption grants. We did post them on the site, so you can go on and see what is being done to try to help our businesses. We'll be putting a list together from the Intergovernmental Grants Department, Mr. Stubblefield's office, to show that the businesses are trying to get help during these hard times. So
yeah, and a lot of you'll see a great number of our local businesses were helped by those grant funds. So it's educational to know that those dollars are flowing here to our community, and this allows you to see where they're flowing. So that's information is power.
exactly, and people were asking for it. So, and just like yesterday, one of the viewers wanted to know about keeping their glasses from fogging up, and we were able to provide that to them because we've all experienced that to wear glasses. So, hopefully, the person who asked for that received that information last night. Day 290, we'll be back tomorrow with day 291, hopefully with better numbers. We got to get them going down. The quicker we get them down, the quicker we can try to get back to normal. We'll be back with Daisy in just a few moments to translate this into our Spanish communities, and we'll see you tomorrow afternoon. Have a good evening.
We must find a way to live with COVID-19 until a vaccine is ready. One proven thing we know is that masks do work. By wearing a mask, you can do your part to help your community by limiting the spread of the virus and thus helping our businesses remain open and our hospitals able to handle the capacity. To get through this virus, we must work together as a team, and you should do your part by wearing your mask, washing your hands, and watching your social distancing.